start with this question. The question was something like this, that there was a patient who has been operated for a cholecystectomy in the past, and on the 5th post-operative day she presented with some pain. An ultrasound was done and there was some collection noted in the Morrison's pouch or in the region of GB fossa, and a suspected biliary leak is there. Now what should be done? Now when you look at the question, there is a doubt about what was the exact question that was asked, but the whole idea was that they are suspecting a biliary leak. Okay, now if the question says most sensitive investigation to detect biliary leak, the answer should be HIDA scan. The most sensitive test to detect biliary leak, it should be HIDA scan, because now what happens is that whenever there is a leak, now this the radionuclide compound is going to leak from that particular area, and wherever there is a collection, it will be pooling up and the gamma rays can be picked up from that particular part. So that is supposed to be the most sensitive. But the point to be noted is the specificity of this is not very great. The second is, because it is not an anatomical image, you will not be able to pinpoint the exact anatomical site. Now if you ask me the best way to identify the site of the leak, then it will be ERCP, because in ERCP, from the distal part of the CBT, you are injecting the dye and you are not just seeing the leak, you are also able to identify the exact site of the leak in that particular case. So again, all goes with the language. Okay, now if you ask me what is the most appropriate initial investigation in that particular case, I would say that ERCP is the best, but because it is invasive, I would like to go with a non-invasive investigation like an MRCP, which can also identify the potential leak. So now if I tell you the protocol, the standard protocol in the post-op patient, that what we do is we do an ultrasound to look for a collection. Now if the collection is there, now it could be a post-operative collection or it could be a biliary leak. Okay, and in these cases we prefer to perform an MRCP to identify the potential site of the leak. If the MRCP can identify the potential site of the leak, we go for a treatment. Now an ERCP guided stenting can also be done, or an exploration can be done. Now in some cases where the facility of the nuclear scan is available, you go with the HIDA scan to identify whether this is a post-operative collection. Now because if it's a post-operative collection, you will not see any pooling of gamma rays in that particular area. If it's a leak, you will see the pooling of gamma rays in that particular area. So lot of controversy on that particular part, but yes, if the most sensitive investigation is being asked, I agree that it should be HIDA scan. Now in our surgery class, Dr. Jay has very categorically written it that the most sensitive test to identify the leak should be the HIDA scan. But please remember, if they ask you the best test to identify the site of the leak, okay, then probably it would have been ERCP. If you are suspecting a leak, what is the initial investigation that should be done? Then I will say it should be MRCP. So that is the biggest challenge that happens in a clinical question, that everything is dependent on the exact language of the question. Now in your NEET exam, if you get a question, please see the exact language and on the basis of that try to pick up the correct answer. Okay.